Welcome to this video on understanding anxiety. We will cover the basics of anxiety, its physical signs and causes, practical coping strategies, and effective professional treatments. What is anxiety? It is a natural feeling of worry or unease, often a response to stress or danger. However, persistent anxiety can significantly interfere with daily life, making it important to recognize both the physical and emotional symptoms. It's important to distinguish between normal anxiety and an anxiety disorder. Normal anxiety is temporary and can actually improve focus. An anxiety disorder, however, involves excessive and persistent worry that significantly interferes with daily functioning. There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, and social anxiety disorder. Specific phobias and separation anxiety disorder are also recognized types. Anxiety can stem from biological factors like genetics and brain chemistry. Environmental stress and traumatic life events are also key contributors, and certain personality traits, such as shyness, can increase risk. Physical symptoms of anxiety often include a rapid heart rate or palpitations, shortness of breath, and feelings of choking. You might also experience sweating, trembling, dizziness, or lightheadedness. The fight or flight response is a biological survival mechanism preparing the body for immediate action against a perceived threat. The freeze response is a third common reaction triggered by danger or perceived threat. Anxiety's physical symptoms are the nervous system's response, activating the fight or flight mechanism. This involves an increased heart rate to prepare muscles for action and rapid, shallow breathing to deliver needed oxygen. Once again, the physical symptoms of anxiety commonly include rapid heart rate and palpitations. Other signs are shortness of breath, sweating, trembling, or feeling dizzy and faint. False alarms activate the same body response as true danger. Perceived threats trigger fight, flight, or freeze. Excessive false alarms, however, can lead to chronic stress, while true danger requires immediate action. The false alarm model illustrates that perceived threats activate the same fight, flight, or freeze response. Excessive false alarms can lead to chronic stress, while true danger requires immediate action. Avoidance is a common short-term coping mechanism that offers temporary relief from anxiety. However, avoidance reinforces anxiety by preventing new learning. Facing fears is necessary to break this negative cycle. While avoidance offers short-term relief, it reinforces the belief that the feared situation is truly dangerous. This prevents learning positive coping skills, and long-term avoidance significantly limits personal growth and experiences. Regulating your nervous system is key. This involves balancing activation and rest. Deep breathing can calm an activated nervous system, and mindfulness helps you observe and manage your reactions. A simple breathing skill involves diaphragmatic breathing. Focus on slow, deep breaths, inhaling slowly through your nose, counting to 4, and exhaling slowly through your mouth, counting to 6. The 5 senses grounding technique helps return you to the present. Notice 5 things you can see, 4 things you can touch, 3 sounds you hear, 2 things you smell, and 1 thing you can taste. Your regulation toolbox includes deep breathing to calm your nervous system and grounding techniques for present moment focus. Mindfulness helps manage reactions, and facing fears breaks the avoidance cycle. When anxiety strikes, use an anxiety alarm check. Identify the feeling and physical sensations, ask if a true threat is present, determine if it's a false alarm, and consider a helpful action plan. Mindfulness is helpful for anxiety by allowing you to observe anxious thoughts. Practice accepting feelings without judgment. Non-judgmental awareness calms the nervous system, and being present reduces future worry. Effective professional treatments include cognitive behavioral therapy, or CBT, and exposure therapy to address avoidance. Medication, such as SSRIs, can manage severe symptoms. Professional help offers structured coping strategies. Worksheet 1, the anxiety alarm check, helps you differentiate real danger from false alarms. Use it to record the situation, body sensations, and evidence supporting your determination of the alarm type, then choose a helpful response. Worksheet 2, Avoidance Cycle Awareness, increases insight into your avoidance patterns. Identify what you avoid, how avoidance helps short-term, its long-term effects, and a small step you can take instead. Key takeaways. Anxiety is a protective sign from your nervous system. Avoidance offers momentary relief but reinforces fear. The goal is to change your response to anxiety, not eliminate it entirely. Take time to reflect on how anxiety physically appears in your body. Identify situations you avoid and consider small actions that provide relief. Also, acknowledge the coping strategies you already use successfully. Worksheet 1, the Anxiety Alarm Check, provides a structured way to assess if your anxiety is a false alarm or a true danger. It guides you to identify body sensations and determine effective actions.